This video lecture will cover developmental disorders, where we see a physical change or physical limitation in the brain itself that results in some type of behavioral or cognitive alteration. Now, remember that back in last week's material with the nervous system, there was a PowerPoint that reviewed some of the major brain structures. It'd be a good idea to go back and rewatch that just to kind of refresh yourself on some of the brain structures. I'm going to mention a few of those during this special lecture and even later in this whole chapter. So it'll be a good idea to review through that. Now, a physical change in the brain is going to cause some type of incorrect signaling. And so whether something was improperly formed during development, during the fetal stage, or traumatized, it's going to result in each part of the brain not communicating with each other correctly. And what part of the brain is affected will determine what the signs and symptoms that result. It could be a trauma to an individual, congenital, something that happened in the womb. Familial means that it could be something hereditary, or it could wind up being something that was induced by early development. We talk about things like cerebral palsy, shaken baby syndrome, those would be examples. We're going to take a look at some of the most common developmental disorders and kind of give you a snapshot of each one of these to show what we're talking about. First one is called intellectual disability. The old-fashioned term used to be mental retardation, which has fallen out of favor. But basically, there's just simply a limitation in cognitive skill. The person can't think at the same, age level as what is considered normal development. And so again, it kind of depends on, how early something like this happens or what causes it to determine how much of a disability occurs and how much the person is able to overcome it or not. Dementia is a deficit in language, memory, or mood. There's a specific lack in one of these skills, as it were. We have talked before about strokes in the brain, and so that's a good example of a vascular form of dementia. And so if there's been some traumatic event that's caused loss of oxygen to a part of the brain, the language center, for example, that could wind up shutting down an ability for someone to be able to communicate properly. Aphasia, as you see on the screen there, refers to specifically a deficit in language. And so depending on what part of the brain is affected, you can have different types of aphasia. Wernicke's aphasia is when a person has the difficulty in receiving and interpreting language. And so if your patient had a stroke that damaged Wernicke's area, then when you would talk to them, they wouldn't understand you. They would misunderstand what you're saying because they could not receive the language properly. They could tell you something, but they would have a hard time understanding you. Broca's aphasia is when someone has difficulty in expressing language. And so a patient with Broca may have being able to speak clearly. Someone who's had traumatic brain injury, we see very common stuttering or loss of specific sounds that they can make. Different letters might be difficult for them to be able to arrange the muscles that allow them to properly say something. Occasionally, you can also refer to someone having dyslexia, and dyslexia is also in some cases referred to as language shuffle. And that's where an individual, it's similar to the Wernicke's a little bit, in that the person trying to read something, the letters in a word may mix or the words may mix. Or when a person writes it, they may have a Broca's dyslexia where they want to write out the word water, and they'll write a W-A-T-R-E. And they may or may not notice that it's wrong, and they may think it's fine, or they may think they may know it's wrong and try to fix it again. There's different variations of dyslexia, and there's several variations of aphasia, so you have to be very mindful of that. Let me jump ahead really quickly and talk about Alzheimer's syndrome. Alzheimer's, remember, is a senile dementia. And so this is where we have damage within some of the processing centers of the brain. And so we lose short-term memory abilities and a lot of time language. And so very commonly we'll have a disorientation of our subject. Sundowning is a common element that we see in Alzheimer patients, and that's where the person becomes disoriented at sunset. When the sun goes down, that changes your sensory perception of your neighborhood, and so someone with Alzheimer may get very confused and disoriented. If you're if you're a caregiver with an Alzheimer patient, this is usually one of those times of day where you pay a little extra attention to always be with them. So if they get a little disoriented, they go out to get the mail, they don't get lost on the way home, kind of thing. The bottom here, a tic disorder. A tic refers to a sudden, rapid, involuntary movement or vocalization. And so if you get someone that's that little neck tick or that little eye blink or a little bit of a cheek movement, or they may be talking every once in a while, they just have a little movement that just continues over and over and over again, again, again. And so if this happens time and time again, that's referred to as tic. Now, there are transient tic disorders. And so this is something that we can commonly see in adolescents and teenagers. And so transient tic disorder is something that shows up quite often in adolescents. And it's believed that simply as we grow through adolescence, there's physical growth within the brain. There's also hormonal changes in the body that can change a little bit of neurotransmitter levels, and it can cause a little bit of miscommunication in the frontal lobe where you're thinking about something and you're trying to say or do something. Now, most people will grow out of the transient tic disorder within about a year or so, but we also occasionally see a chronic tic disorder, and this is one that does last for several years and usually can last far into adulthood. And so this is usually due to some type of more permanent trauma within the brain itself. Could be We see this occasionally in some people who are long-term drug abusers. We see individuals who may have had some type of very severe viral encephalitis, and it may result in a chronic tic disorder. So some physical trauma to the brain that interferes with good communication between the frontal lobes and your motor centers and your vocal centers. A good example of that is actually something called Tourette syndrome. Um, Tourette, Tourette syndrome. This is an example of a chronic tic disorder. And so this is where the individual will have some type of tic. Typically, it's either a motor tic, like you said, some movement, or it's a vocal tic. They pronounce something or they speak something. Movies will always try to go for this is the person who starts just yelling out profanity all the time. And there have been cases similar to that where someone will throw out words that are unintentional. It's not always swear words. I saw a video interview years ago about a surgeon who had Tourette's. And they would simply hear you say something, and one time out of 20, one word would click on them. And so, if you happen to be talking about the prognosis of a patient, and someone made a comment about, if they don't get the treatment, they're going to be a dead duck. And this person would just lock on that, where they would still keep trying to describe the prognosis, and they would just say dead duck after like every sentence. It almost, it just almost seemed like something like OCD kind of thing, but it wasn't. It was this verbal tic that just kept pushing up, and they knew they were doing it, and they just couldn't stop themselves. Very, very frustrating. Disruptive behavior disorder is due to damage to the amygdala. The amygdala is part of your emotional control center. This helps to control your expression of emotions with things like anger and aggressiveness. And so generally someone with disruptive behavior disorder, some physical damage to this structure usually causes the patient to become a lot more aggressive, especially very reactively aggressive. They may at times be, normal, and then just some little thing that should get them a little upset gets them just furious, wanting to fight. Chronic alcohol toxicity very commonly can damage the amygdala in this fashion and cause them to become very belligerent at just, the slightest provocation. Sensory integration disorder. Now, this is an imbalance in the thalamus. Remember that the thalamus is the structure that communicates stimuli from various lobes in the brain. And so this is the one that draws all the sensory information in for like vision, touch, hearing, all that, and processes it properly to the brain. The person with sensory integration disorder misprocesses information. It'd be like sending mail to the wrong location. And so they may feel something that should be painful, but they actually get a positive sensation out of it. And so if they hurt themselves, it either doesn't feel anything or may feel a little bit good. There are some people who will vice versa. When they feel something soft, to them it feels like sandpaper, and their brain is simply misinterpreting incoming sensory information. They may see bright lights, and to them, they perceive that as just this god awful loud ringing in the ears because you're sending information to the wrong cerebral lobe. The last two I'll mention in developmental disorders are due to the reticular formation. The reticular formation is a deep brain structure that helps you to focus on sensory stimuli. And so you're looking at the image of me in my room, and you can see all the pictures and everything behind me. And generally speaking, let me do this really quickly to show you. What your reticular formation typically does is this. And so your reticular formation learns to still notice the background stuff, but blurs it out just enough that you can focus on me more easily. That's the job of the reticular formation. Pop that out, and we'll go back up here. Now, we can find two disorders that are due to an incorrectly functioning reticular formation. Autism spectrum disorder results from a hyperreactive reticular formation. It's too strong at being able to filter out all the background. So imagine if suddenly I flipped all the lights off in the room except for one little spotlight just on me, you couldn't even see the background. These individuals they're drawn to extreme stimuli. Simply because that's the only thing they can see through this. It'd be like you trying to look back there and see little Grogu. You'd have to really, really squint at that to the point that you'd stop listening to me and really have to hyper focus on that. They have social limitations, usually because they're usually so hyper focused on something to the extent that it's hard for them to keep track of all the other cues in communication. Posture, verbal, facial. It's hard to maintain all those. Now, again, I'm going to mention this is a spectrum disorder. There are very minor levels and very major. So, if you've known someone with autism, I'm not trying to say they all present one way. Remember that there are variations. I'm simply giving you some of the most textbook examples. On the other side of that is attention deficit and hyperactive disorder. This is when the reticular formation is too weak. And now it's easy for you to lose your attention on me if you get really kind of curious about the skeleton back there, or you notice that it must be dark because there's no light coming in from the window, or you get easily distracted. Think of it this way. Imagine if you were facing this entire row of monitors, each one of these showing a different channel, a different program. Now, your normal reticular formation would do this. It would allow you to focus on that one image with the flag. It would mute the other stuff partially, so you're still generally aware of it. So if you suddenly want to notice something changing with the sunflower, you can, but you can more easily focus on that image. This is what happens in a patient with attention deficit hyperactive disorder. Everything is just as loud and just as bright. And so that becomes difficult for a person to stay focused on that because it's an oversaturation, because the reticular formation is too weak. This is what would happen in someone with autism spectrum disorder. It'd be such a tunnel vision effect that they could focus on the one image with the flag. Everything else would just simply drop off their perception. They wouldn't notice it at all. And so hopefully that gives you a little bit of an idea of how that reticular formation could cause all sorts of problems in one direction or the other. All right, that's a quick and dirty example of some of the most common developmental disorders. There are others. If you have a question about any of those, feel free to go ahead and email and ask me. Come to the Zoom office hour. Be able to look through these and have a general idea on how to recognize signs and symptoms or brain structures for each one of these listed. If you have any questions, as always, please reach out and good luck.